Hello everyone, welcome back to Counselor Wise's Corner, where I aim to empower others one wise counsel at a time. Class is now in session. Today, we will be talking about 4 major factors that could be affecting your mental health as a Jamaican. Bear in mind, guys, that one or more of these factors may be affecting your mental health regardless of your nationality or where you live. So if you are not a Jamaican or living in Jamaica, this video may still be helpful. So please, stick around. Number 1, childhood traumas, also known as adverse childhood experiences. The effects of childhood traumas can travel with you into adulthood and continue to negatively affect your mental health. So ask yourselves these questions. Were you abused or neglected as a child? And we all know what abuse is, right? Whether it is physical abuse, verbal abuse, sexual abuse. Or were you neglected? Whether your parents failed to give you the emotional support that you need, or they failed to provide for your basic needs. Did you witness a lot of violence in your home or community? And violence in your home could refer to mommy and daddy fighting all the time, or your guardians cursing, or anything of that nature. Or violence in your community could be witnessing a murder, or seeing fights, or seeing persons using weapons to harm each other. Things of that nature. If your answer is yes to one or more of these, and as an adult you are suffering from severe anxiety or have panic attacks, or you are having difficulty sleeping, maybe you're experiencing trust issues or having severe anger problems, then your mental health is likely being negatively affected by your unresolved childhood traumatic experiences. Number 2, crime and violence. Are you always on the alert for potential danger? Do you experience anxiety-related symptoms when you hear unexpected loud sounds? Do you consistently feel unsafe at home or on the road? Do you try to avoid leaving home to go anywhere, whether day or night? Hypervigilance or super alertness is abnormal. It's not normal, guys. And it is an indicator that your mental health is likely being negatively affected by the high incidence of crime and violence being experienced in your community or even in the wider society. Number 3, complicated grief. Now, grief is generally a normal response to the loss of a loved one, and usually has accompanying symptoms of intense sadness, sometimes feelings of shock and numbness, or even denial and anger. All of these, however, are expected to ease over time, so it should get better over time. However, grief becomes unhealthy and is considered complicated when it does not follow the general pattern of improvement over time. Instead, individuals continue to experience persistent and intense emotions or moods and unusual severe symptoms that affect major areas of functioning or that cause extreme distress. Now, a person that is suffering from complicated grief will display symptoms that may include the following: continuous yearning or longing for their lost loved one, constantly thinking about the way that the person died, intense sorrow and or distress that does not improve over time, difficulty trusting others, depression, a desire to join their deceased loved one, persistent feelings of loneliness or emptiness, impairment in the social, work, or other areas of their lives. So if you have been suffering from these symptoms for about 6 months or more, then you are likely to be experiencing poor mental health due to complicated grief. It's also important to note that the more loss you experience, especially within close proximity of each other, is the more it impacts your mental health. Complicated grief falls at the top of the mental health pyramid. So for those of you who have not yet watched my first video about understanding your mental health, please do so, and that will help you to better understand what mental health looks like at this level of the pyramid. Number 4, chronic stress. Yes, you heard right. Long-term stress. Chronic stress slowly drains your psychological resources and damages your brain and your body. The signs and symptoms that you are experiencing chronic stress can be cognitive, which speaks to your thoughts, physical, emotional, or behavioral. So, answer these questions. Have you been struggling to make ends meet financially? Living from hand to mouth, sometimes you can't even find it before the next paycheck, and you have a lot of bills and business to take care of. Do you dislike your job, but you still have to get up and show up for work? Are you unhappy in your personal relationships, whether romantic or family? Maybe you are experiencing challenges with your partner, or you may be at constant odds with your family members. If your answer to any of these questions are yes, and you are experiencing 3 of these 5 symptoms I am about to name for more than several weeks, then your mental health is likely being affected by chronic stress. So here we go. Aches and pains, insomnia or sleepiness, staying in more often than you're used to, low energy, unfocused or cloudy thinking, changes in your appetite. Are you eating more? Are you eating less? Increase in your alcohol or other substance use? Are you short-tempered or experiencing emotional withdrawal? All of these symptoms point to chronic stress. Now guys, if you or anyone you know are being impacted by these factors or others, know that you can get help. Talk to someone you can trust, or better yet, talk to a trained professional who will resource you with tools that will help you to cope. With that said, that's all the time we have for today, guys. But before you go, I'd like to leave you with this quote from John Green. There is hope, even when your brain tells you there isn't. See you in the next video. Remember to subscribe, share with someone who needs to see this, like and comment. Bye.